I'm Hannah Farley, and today I'm going to be talking with you about the importance of exercise for older adults. So the first question we have to ask ourselves are, why have them exercise? What are the benefits of exercise to the elderly population? And so we have a few different benefits. We have physical benefits and other benefits. Some of the physical benefits presented by Howley and Thompson include an improvement in blood lipid profile. What that means is they have lower LDL, which is bad cholesterol, and higher HDL, which is the good cholesterol. So this is a very important physical benefit of regular physical activity for older adults. Another thing is lowering blood pressure, which helps prevent hypertension, and hypertension can cause a lot of issues with damage to vessels and the heart and other things. It also improves insulin sensitivity, and this is important because it can help ward off type 2 diabetes. Decreasing the resistance to insulin is a really important factor for older adults since they are already at a greater risk for type 2 diabetes. Some other benefits that we have found for older adults with physical activity was in a study done by Lautenschlager and her associates. And what she found was that regular physical activity actually helped to delay the clinical progression of dementia. So that means that if we have older adults staying active, signs of dementia and the issues that come with dementia didn't happen as quickly as opposed to control groups where they weren't physically active. Another thing they found was that exercise can help decrease depression and improve mood, which is true for anyone who is being physically active, but this is especially important for older adults who can be lonely and have more issues with mood and depression and stuff like that. So we have a few fitness tests that we like to have older adults do. One is to find out their VO2 max, and their VO2 max essentially is how many milliliters of air per kilogram of body weight a person can use in a minute. And this is helpful because it helps us to understand where they're at in their cardiorespiratory fitness. So one way that was found to be very helpful for testing this in older adults was using a cycle ergometer. And this was done by the researchers with the Life-P study experience. And they felt like it was a more useful way of finding VO2 max for older adults because it didn't put as much pressure on the joints like walking or running would do. Some people are concerned that it doesn't give an accurate reading just because of muscular endurance fatigue in localized areas like in the legs, but they found that it was a very useful way to measure VO2 max, and it helps set a good baseline for how the older adults are improving in their cardiorespiratory fitness, or CRF. So this is an important one, and it's a good thing to start off an exercise program with and then check every 6 months to a year to see how the aerobic activity is affecting their CRF. Another test that's really helpful for older adults is the 30-second chair stand test, and this is important for testing lower body muscular endurance and strength. And basically what it does is we see how many times in 30 seconds the participant can stand up to a full upright position from being seated at a 17-inch chair. So this is safe for older adults. It's a really good way of measuring their strength, and it's very sensitive. And when we say it's sensitive, what we mean is we are easily recording changes in muscular endurance. So if someone is doing a resistance program that's focused on lower body strength, this test is really good at being able to see the gains that the older adult is achieving. Now, there are some recommendations that we have for older adults. The main recommendation, the basic recommendation, we should say, is that older adults should be engaging in at least 150 minutes of moderate intensity exercise per week, or at least 75 minutes of vigorous intensity aerobic activity. So this helps us set a baseline for what is good to maintain the CRF they have, the VO2 max they have. Obviously they can do more, and that would be helpful, but these are like the baseline. And we found that for extra benefits to really improve their cardiorespiratory fitness, it's a good idea to use 300 minutes per week of moderate intensity or 150 minutes per week of vigorous intensity activity. And this is based on information given by Howley and Thompson again. So some ideas for a good way to incorporate aerobic activity for older adults is to have group dance classes. Actually, my 100-year-old grandma a couple years ago sprained her ankle, unfortunately, in a group dance class, but she said that she and her friends in the senior community loved the group dance class, and it was a really good way to socialize as well as get some physical activity. Another thing that we could have older adults doing is walking programs. This can be individualized or group program depending on the needs and wants of the senior citizens. Swimming is another great thing. It doesn't put as much stress on the joints, and this can be really helpful for older adults. And often older adults find that they like yoga and Tai Chi because it's a slightly slower way of getting some aerobic activity, and it also helps with stretching and with strength training, which is what we'll get into next. So strength training is really important for older adults. We found that as adults age, they lose muscle mass, lose muscle fibers, and this can affect not only your resting metabolism rate, but also your bone density. So if strength training is maintained, it actually can help maintain a higher bone density, which can help ward off osteoporosis. So it's recommended that older adults begin training at a light intensity, and this means 40 to 50% of their 1 rep max, which is the most amount of weight that they can lift in 1 repetition. Once they've gotten used to this training regimen, then it's a good idea to increase it to intense resistance training, which is considered 70 to 80% of the 1 rep max, and according to Helly and Thompson, this has been one of the most effective ways to see older adults gain muscular endurance and strength. And they also suggest that it's a good idea to combine strength exercises with balance, because so many older adults can be prone to falls, and when they break bones, it's way more detrimental to them than it is to younger adults. So adding balance in, like with yoga or something like that, into your resistance training is a very helpful tool for older adults. Now finally, flexibility is really important. As we age, we lose our range of motion a little bit with joints, but we can help keep our range of motion as optimal as possible by incorporating flexibility training, which means stretching and activities that focus on stretching the muscles. It's recommended, according to Stathakostas, that flexibility training be done alongside a cardiorespiratory activity or strength training activity. And this is mostly because when we're doing this, our muscles are warm, and this makes it easier to stretch and maintain that range of motion, especially for older adults where stiffness can set in with the joints. Some of the ways that are helpful for increasing flexibility are using yoga and Tai Chi and dance or Pilates classes, and this can be done on their own. Older adults can do it on their own, or they can do it in a group setting again, which can be really helpful for older adults to have more group activities. We can also teach older adults just basic static stretches such as hamstring stretches, quadricep stretches, and stuff like that, just to maintain the range of motion in their hips and lower back. So in general, it's really important for older adults to have all of these elements of flexibility, strength training, and cardiorespiratory training in order to keep them at the optimal fitness level and to improve their quality of life. Thank you so much.